So moving on to the peroneals now, or for some people, depending on where they live, the fibularis. We're going to anchor underneath the foot here, and then we're going to run the tape up and around the lateral malleolus and then along the belly of the peroneals. So we have longus, we've got brevis here, and then tertius is a little bit more through the front here. So if you're looking at doing tertius, you'll need to come a little bit more towards the front of the foot, and then obviously tape across this area here as if you were taping extensor digitorum longus. Or, for that matter, we've got tibialis anterior through here. So tib anterior, extensor dig, okay, that's the hullus, and then we've got our peroneal muscles coming up here. So we'll take the greater, so meaning the longer ones, anchoring off there. Lee is kind enough to invert her foot, which is fantastic. And then we're going to go around or over the lateral malleolus and along that lateral part of our leg. Place that down just over the head of the fibula. Okay, brevis is about here. The trigger point's in and around that area there. It's about right there. Okay, and then obviously the trigger point is more towards the top here. Now remember, this muscle is really important when we're talking about lateral ankle sprains. So obviously if we've rolled the ankle and we've damaged these lateral ligaments here, which is not ideal, but a secondary problem obviously becomes with this peroneal longus and obviously brevis as well. So they get this secondary pain, and obviously trigger points will form along the belly of these muscles. Obviously brevis will be one of them, and then there'll be another one up here in the longus as well. So very, very common. Not that we can do anything here in the acute stages, maybe some lymph drainage and so forth, but obviously we need to look at taking out any trigger point activity in the length of the peroneal. So if we go for brevis here, then obviously along, you're pushing up against the fibula. So the beautiful thing is that you'll be able to feel the trigger points quite strong straight away. So about there, yep, terrific. Still in inversion, just going to roll the leg over a little bit more. Place that down there. Lift the leg until that tail down there. And then pulling that off there. That's our peroneals.